Hello, it's Nashi again, and today I would love for us to be talking about one of the biggest mistakes a lot of women in their reproductive age make, which is waiting until they become sick before checking their health. Many conditions actually do not show symptoms until they become more serious. If your reproductive age, whether you're planning to have children now, later, or not at all, here are some investigations that you should know or you need to carry out as a woman in your reproductive years. Number one is full blood count. This checks for anemia, infection, and other blood disorders. A lot of women lose blood during their periods, and it is so important that you as a woman know whether your blood levels are within the normal range. Another one is thyroid function test. As thyroid imbalance affects ovulation, your cycle, and pregnancy outcome. So this is one of the important investigations that you should carry out as a woman in her reproductive age. It's also helpful to know your blood group and your rhesus factor, especially if you are planning pregnancy or you intend to get pregnant in the future. Know your blood group and your rhesus factor. If you are sexually active, STI screening is something that you should not overlook as a woman in her reproductive age. Depending on your individual risk, tests for HIV, hepatitis B, hepatitis C, chlamydia, syphilis, gonorrhea can actually help to detect these infections early and help to protect you from protect your long-term reproductive health. All right, so it is something that you should endeavor to do. STI screening. One other investigations that I strongly encourage women in their reproductive age to carry out is cervical screening, what we know as pap smear test or HPV test, right? So once you are eligible according to your own country's screening program, it is something that I encourage you to carry out because it helps to detect abnormal changes in your cervix before they develop into cervical cancer. Now, depending on your personal health, symptoms, or family history, your healthcare provider might actually recommend a few other tests like your lipid profile, to check out your cholesterol, kidney function test, liver function test, and also some iron studies, especially if you're having heavy menstrual bleeding. Talking about scans, one of the most useful that I would recommend is pelvic ultrasound scan. This scan can actually help to identify fibroids, ovarian cysts, some other causes of pelvic pain, abdominal bleeding, or other reproductive health conditions. So it is something that you should do if you know that you are in your reproductive age as a woman. Also, if you notice any lump or unusual changes in your breast, please do not ignore it as a woman in her reproductive age. Your healthcare provider might actually recommend a breast ultrasound or a mammogram depending on your age, your symptoms, and your individual risk. One thing I would love for you to remember is that not every woman needs every of this investigation every year. So all of this tests is actually dependent on your age, your symptoms, your medical history, your family history, and your individual risk factors. Remember that the goal is to detect these problems early before they eventually become serious. Your health is one of your greatest investments. So please do not wait until something feels wrong before you actually pay attention to your body. If this video was helpful, please do like, share, and comment. Follow Real Nurse for more evidence-based women's health tips. Okay? And if you're a man out there, do well to share this video with that woman that you care about, okay? And do not forget to encourage her to book that health check that she has been trying to put off all this while. Bye, and thank you for watching.